Hello students, so we are continuing with the characteristics of the healthcare industry. Okay, so the next characteristic is the perishability. So services here are intangible, so they cannot be packed and neither can be stored. The implication is that the service has to be produced and consumed instantly and there is no scope of storage. Yes, of course, the transaction, of course, it is there till the time the patient is taking the treatment with the doctor. But as soon as the treatment with the doctor or the service provider ends, it also the whole thing ends, right? So we know that services have got this are intangible and they cannot be stored. So the perishability is of course there in case of healthcare industry as well. Yeah, if you see the healthcare industry in terms of the medical equipment or insurance kind of thing, then insurance, yes, of course, it also depends upon the policy agreement and all that. What is the duration of that policy agreement between the patient party and the insurance provider. However, in case of medical equipment industry, yes, you also get to buy various medical equipment and you can store them. But however, when we say about the healthcare industry of the service providing, which ultimately it is the goal of the service industry to either provide treatment to the patient or either provide medical education to the aspirants. So then in that case, the services are intangible and the perishability is there, right? So it has to be, the service has to be consumed there and there instantly and there is no scope for storage. So let's move to the next topic, that is okay, so this is as a whole the characteristics of the healthcare industry. It's a strong demand. So healthcare market in India is expected to reach $372 billion by 2022. Okay, so strong demand, as in, see, when we talk about the healthcare industry, we have to realize one thing is that, the demand for the healthcare service will never end. Because there are a lot of factors, because we human beings, we always are in a state of health and positive health or negative health, right? So, and we have also other characteristics, like for example, because of new invention and medical treatment, the whole thing of the life expectancy of human beings have increased, have improved a lot, and that has given rise to a huge number of aged population. And when we say about the rising number of aged population, of course, with the aging population, rise in the aging population, the burden of disease also get increased. We have got our middle class population, where they demand the, and with this rise of the middle class population, we have got the huge demand of quality care, as well as with that at a very cheaper price. So you can see that one side the aging population is increasing, the burden of the disease is increasing. One side middle class population demands is increasing to get a quality treatment at a reasonable price. And then there are other factors as well, like for example the pandemics and all the new diseases which are again coming up. Like as of now we are struggling with coronavirus, right? So COVID-19 is something which has also tremendously given us this reality check that yes, we have to have good healthcare infrastructure in our country, so that we can deal with a huge number of patients. So we have seen various pandemics in our history as well, like like swine flu, and then we have got Ebola virus, AIDS, HIV/AIDS was so this kind of diseases which really brings a lot of thought into our mind that yes, we need to have a stronger system. So there is a huge strong requirement. The population in our country is huge, and likewise the demand is also huge. Moreover, we can see that we have got our rural sector, we have got our urban sector, and our population is very diverse, right? So yes, so, and then there is also shortage of the healthcare professionals. In another hand, we have got lack of infrastructure. So there is going to be a strong demand in the healthcare industry. Okay, so we'll continue with this lecture in the next video. Thank you so much.